Hello, my name is James Long. I'm an RN, one of the house supervisors here at Vibra Hospital. Here at Vibra, we also take care of cardiac patients. Most generally, we see patients with AFib, also called atrial fibrillation. That's where the top part of the heart is not beating like it should, and so it just basically quivers. The thing that we have to be concerned about at that is when the heart is quivering, it has a tendency to develop blood clots because the blood is not churning. So as it beats, it showers little blood clots all the way through the body. The first place that it goes is into the lungs. And if they're very small, then they pass back into the heart, and then they can be pumped up to the brain, which can eventually cause a little stroke. And we've seen that in a lot of patients. Here at Vibra, all of our patients that are admitted to the ICU are put on a cardiac monitor. And we have a person sitting at the desk watching those monitors 24 hours a day. We also have patients out on the floor that are on a telemetry unit, also monitored by that same person. So we can watch their heart rate, we can watch their heartbeat, and so then we can treat as necessary. Most of the time, we don't have a cardiologist in-house, but we have pulmonologists that we are in constant contact with. So if we see something irregular, the first thing we're going to do as ICU nurses is treat that the way that we best know how. And then we're going to contact the doctor and let them know what's going on. With the AFib, there's also, that goes along with that, is called rapid ventricular rate, AFib with RVR. And that can be a very serious problem. Heart rate can get up into the 130s and 150s. And that's not good for your heart. Eventually, it's going to wear out and just stop beating altogether. So we have medications that we can give that helps get that heart rate down. And all of our nurses are highly trained in ACLS protocol. And so we can do things prior to even calling the doctor. But once we get the patient stabilized, which is our biggest important project, then we're just going to give the doctor a call and let them know what's going on, and see if there's other things that we might be able to do. One of the most important things is once we get them stabilized, we're going to do a chest x-ray and then also do labs. But all of that stems from just good nursing judgment and knowing what to do when the time comes. And so we want to help fight AFib. The bad thing is most of the population is walking around in AFib and don't even realize that they have it. And then all of a sudden they have a little stroke and they have no idea why. And then it comes back to having AFib that goes undiagnosed. Anytime anybody has chest pains, they should contact their doctor immediately, as it could be life-threatening. And here at Vibra, while we have them on cardiac monitors, that is something that we're certainly watching for, is any change in the heart rate, in the heartbeat, whether it gets too fast or too slow. So all of our patients that are high risk for heart problems are already being monitored. And that's one of the things that we take pride in here at Vibra Hospital, is that they are closely monitored and they're being watched all the time. So we can certainly take care of any cardiac problem here at the Vibra LTAC Hospital, either in the ICU or out on the floor.